that we will continue to have adequate or maybe even a little bit extra supply. We have been able to keep supply at all 220 providers.
The Tennessee Department of Health says today the state still has adequate supply of monoclonal antibody treatments, and that treatment does boost a patient's immune response. It also helps prevent patients from developing severe symptoms. Reporter Mary Klingler spoke to a local pharmacist who says the demand for that treatment is slowing. Mary?
Well, John, this comes after the Department of Health recommended prioritizing unvaccinated people for the treatment last week, warning the state could get less of the life-saving drug. Now, today they say they have not had to use that recommendation.
The number of cases that East Tennessee is seeing is dropping, which I believe is helping the demand issue by not having as many people that are as sick needing it.
Dr. Tyler Darty is a pharmacist at Clinton Drugstore, one of the places in East Tennessee offering the monoclonal treatment. He says there's been a decrease in demand that is increasing the allocation of the medication. The goal, to use the medicine to treat early cases of COVID-19.
I view it as something that's allowing the hospital providers a little bit of a relief that they're only dealing with maybe the sickest of the sick.
He says hospitals have stronger treatments better suit for severe illness. Doctors ask a series of questions to see if you're qualified for the monoclonal antibody treatment.
How old are you? Were you vaccinated? Were you not vaccinated? Along with what kind of disease states do you have? Do you have diabetes? Are you immunocompromised? Do you have cardiovascular disease? Are you overweight?
Any of those risk factors, he says, are going to qualify a patient to get the therapy.
We typically look for those high risk factors, especially in people who are unvaccinated.
He says the treatment is by no means a replacement for the vaccine.
Vaccination is really the best thing to do to get out of this pandemic, to be able to prevent COVID from happening, to be able to prevent people from even having to get this monoclonal therapy. And it's the safest way to stay healthy and to not get sick.
The Department of Health says today that supply is expected to last throughout the fall and maybe even to the winter seasons. John?
Encouraging developments. Mary Klingler on that story. In Farragut.